Borderline personality disorder is essentially somebody who has real instability of mood. They typically are not able to sustain relationships. They tend to self harm, strongly consider suicide. They're impulsive in a variety of areas. So, that is some of the criteria we look for when we're diagnosing BPD. But the main criteria, the one at the top, which I think is most important, is frantic efforts to avoid real or imagined abandonment. Because people with BPD have a really sensitive brain. So they're really born more sensitive to stimuli in their environment. And that gets in the way of attachment. So, what creates BPD is a very sensitive brain interacting with an environment that this person experiences as invalidating, especially as a very little person. And even the best parents, if this person's sensitive enough, this little person is going to feel like those parents are still invalidating because no one really knows how to parent a super sensitive child. And that gets in the way of forming some really important things, which is how do we form attachments? That happens between the ages of 9 months to 3 years old. And what happens at the end of that is they don't really have the ability to form these really important attachments that are going to stay with them for the rest of their life. They're going to struggle with that. And all these criteria, like wanting to die, unstable relationships, they all stem from this fear of abandonment, wanting to stay attached, but struggling when attachment is there. So a lot of people say BPD is like this, and that's really what that's from. It's, oh, cool, now that I know you, hooray, and I'm so scared. I'm so scared because I'm so fragile. I'm so scared because when I feel invalidated, I invalidate right back. And that makes it very difficult to be in relationships.